Stop what you're doing right now. I need you to hear this. Let me ask you something very important. Have you noticed your vision slowly changing? Words getting blurrier? Night driving becoming uncomfortable? Or reading requiring brighter and brighter light? Now here's the part that should stop you cold. Most seniors don't lose vision suddenly. They lose it silently, year by year, until one day it's too late. And today I want to tell you a story about a food most people outside Japan have never heard of. A food Japanese doctors quietly recommend to their elderly patients, not as a miracle cure, but as protection. It's called natto, and what it does inside aging blood vessels, especially in the eyes, might shock you. Stay with me. At 96 years old, Dr. Kenji Nakamura still reads without glasses. His secret? It has nothing to do with expensive surgery, and everything to do with something your grocery store already sells. Stay with me, because in the next few minutes I'm going to show you exactly what he does that most doctors never mention. Here's what happens after 60 that nobody warns you about. Your vision doesn't fail suddenly. It fails quietly. First, reading gets harder. Then, night driving becomes scary. Then, you're squinting at your grandkids' faces in photos. It feels inevitable, like gravity. But it's not. The problem isn't age, it's what we stopped eating. 30 years ago, the average American ate way more leafy greens. Today, we eat processed foods designed to taste good, not to keep us seeing. And your eyes, specifically the back of your eye where vision actually happens, they're starving for one nutrient in particular. This part here? It's called your macula. It's about the size of a pea, and it contains more concentrated carotenoids than anywhere else in your body. These are natural compounds that act like sunglasses for your retina, blocking the damage that turns 20/20 into blurry. Dr. Nakamura has treated thousands of patients over 7 decades. He's watched some lose their vision unnecessarily, and he's watched others, who made one simple dietary change, keep their sight sharp well into their 90s. The nutrient has a name: lutein and zeaxanthin. If you've never heard of them, you're not alone. But your eyes? They know exactly what to do with them. Here's how it works. Every day, your retina is under attack. Sunlight, screens, inflammation from modern processed food, they all create something called oxidative stress. Think of it like rust forming on metal. Your macula starts to deteriorate. Colors fade. Clarity goes. Night vision crumbles. But lutein and zeaxanthin, they're antioxidants. They literally stop that rust from forming. The remarkable thing is this: your eye doesn't make these compounds. It can only get them from food, and your body prioritizes storing them in your macula, the exact place you need protection most. Now here's where it gets urgent. After 60, your body becomes less efficient at absorbing nutrients. Your stomach acid decreases, your gut lining changes. So the little bit of greens you might eat, your body might only be using a fraction of it. Dr. Nakamura's patients who kept their vision sharp didn't just eat salad once a week. They made lutein and zeaxanthin a consistent part of their diet, every single day. And the window for this? It matters. The more years you spend now building up protection, the sharper you'll be at 80, 85, 90. This isn't a quick fix. It's prevention, and it's irreplaceable. So what do you actually eat? This is where it gets easy, and honestly, satisfying. Spinach and kale are your champions. 1 cup of cooked spinach contains more lutein than most people get in a month. Kale? Even more. These aren't health food sacrifices. They're the most nutrient-dense foods on the planet. You can sauté them with butter, add them to soups, blend them into scrambled eggs. Dr. Nakamura has patients who simply started adding a handful of spinach to their breakfast. Eggs are number 2. And this matters because your body absorbs the lutein in eggs far better than from many other sources. The yolk especially. 3 eggs a week? That's a game changer. Boiled, scrambled, fried, doesn't matter. Corn. Real corn, not the processed stuff. Fresh corn or frozen corn contains lutein in concentrations that surprise most people. Even canned works. Peppers, orange and red especially. They taste sweet, they're easy to eat, and they deliver zeaxanthin directly to your macula. Roast them, add to salads, or just eat them raw. Broccoli, Brussels sprouts, collard greens. All of them work. Here's the truth that changed it for Dr. Nakamura's patients. You don't need exotic supplements. You don't need expensive treatments. You need consistency. A salad 3 times a week. A side of steamed broccoli twice a week. An egg with breakfast. That's it. The reason supplements can't compete? Your gut absorbs these nutrients better when they come with the other compounds in whole food. Fiber, other antioxidants, healthy fats from the egg yolk, they all work together. Science calls it bioavailability. You can call it, this actually works better than pills. Margaret is 74. 6 years ago, she was squinting at restaurants' menus. Her optometrist said, "Just accept it, your eyes are aging." So she started the protocol Dr. Nakamura recommends. Spinach and eggs at breakfast, a side salad at lunch, roasted peppers at dinner. For 1 year, nothing dramatic happened. But then, slowly, she noticed she was reading without moving the paper farther away. Her clarity was sharpening. Robert, 68, was terrified of losing his night vision. Driving after dark made him anxious. Within 8 months of adding these foods consistently, he told his daughter, "I can see like I'm 55 again." Not perfectly, but noticeably better. These aren't miracle stories. They're what happens when you stop waiting for your eyes to fail and you start actively protecting them. Here's something most seniors are never told clearly. Your eyes don't fail first. Your circulation does. If you're over 50 and worried about losing your vision, this could be the most important 10 minutes you spend today. Age-related vision problems affect millions, but the root cause isn't just old eyes. It's often hidden in your blood vessels. Stick around to learn why, and more importantly, what you can do about it right now. Let's start with the basics. The retina, at the back of your eye, is like a high-performance engine. It's one of the most metabolically active tissues in your entire body, with an incredibly high demand for oxygen. Scientific studies confirm this. The retina consumes oxygen at rates higher than many other tissues, relying on a constant supply to function properly. Photoreceptors, the cells that detect light, need massive energy to send signals to your brain. This oxygen comes from blood flow, primarily through the choroid, a vascular layer behind the retina, and retinal vessels. If that delivery slows down, the retina starves. As we age, several things happen to our circulation. Blood vessels can stiffen and narrow due to factors like hypertension and atherosclerosis. Blood flow resistance increases, reducing oxygen delivery. Waste products build up because clearance slows. Research shows these vascular changes are strongly linked to age-related macular degeneration, AMD, the leading cause of vision loss in people over 60. This creates a perfect storm. First, tiny vessels narrow and blood flow slows. Studies using advanced imaging like OCT angiography show reduced choroidal blood flow in AMD patients. Second, blood can become more viscous with age due to higher fibrinogen and oxidative stress, making it harder to pump efficiently. Third, oxygen delivery drops and waste accumulates, leading to inflammation and damage. The result? Conditions like age-related macular degeneration, AMD, both dry, slow buildup of deposits, and wet, abnormal leaky vessels. Blurry central vision, eye fatigue. Progressive loss of sharp sight needed for reading, driving, or faces. Cardiovascular risks like high blood pressure, diabetes, high cholesterol, and smoking all worsen this by damaging vessels system-wide, including in the eyes. Evidence links systemic vascular disease directly to higher AMD risk. People with heart disease or stroke history often have more severe retinal changes. And here's the heartbreaking part. Once retinal cells, especially photoreceptors, die, they do not regenerate in humans. Unlike some animals, our retinas can't repair themselves fully. Lost vision is often permanent. That's why prevention matters now, not later, before irreversible damage sets in. The good news? Many vascular risks are modifiable. Large studies like AREDS, Age-Related Eye Disease Study, and others show lifestyle changes can significantly lower AMD risk and slow progression. Improving circulation isn't just good for your heart, it's crucial for your eyes. Key evidence-based steps. Quit smoking. It's the strongest modifiable risk. Smokers have up to 4 times higher AMD chance. Control blood pressure and cholesterol. Hypertension reduces ocular blood flow. Manage with diet, meds if needed. Exercise regularly. Aerobic activity improves circulation. Studies show active people have 70% lower risk. Eat eye-friendly foods. Leafy greens, spinach, kale for lutein zeaxanthin. Fish, omega-3s reduce inflammation. Fruits, veggies, nuts. Limit processed foods and red meat. Maintain healthy weight. Obesity links to worse vascular health and AMD. Schedule a dilated eye exam. Early AMD has no symptoms, but doctors can spot risks. Track your blood pressure. Aim for healthy levels. Add 30 minutes of walking or cardio most days. Boost your plate with colorful veggies and omega-3 rich fish twice a week. Wear UV protective sunglasses outdoors. Extra protection against retinal stress. If you smoke, seek help to quit. Your eyes and heart will thank you. Remember, vascular health ties everything together. What's good for your arteries is good for your retina. Don't wait for blurry vision to act. Circulation issues build quietly over years, but you can turn the tide starting now. Prevention is powerful, and it's in your hands. Talk to your doctor, make these changes, and keep seeing the world clearly for years to come. Here's what you need to know. If you're over 60 and you've already noticed vision decline, this still helps. Studies show it can slow further degeneration. But the people with the best outcomes? They started before they noticed problems. If you're 50 or 55 right now, and you have even slightly blurry vision, this is your window. 10 years of consistent nutrition now? That could mean the difference between reading menus in your 80s and needing someone to read them for you. The science is clear. The carotenoids in your macula, they accumulate over time. You're building a reserve. And that reserve is what keeps your vision sharp for decades. Your vision isn't a fixed thing that declines on a schedule. It's a system you can actively protect every single day with foods you probably already buy. Before you change your diet significantly, talk to your doctor. If you're on blood thinners or have absorption issues, these foods can interact with medications. That's not a reason to avoid them. It's a reason to have a conversation with your healthcare provider. This isn't medical advice. This is what Dr. Nakamura has observed in 7 decades of clinical practice. What happens in his office isn't the same as what your eyes need. But if you're generally healthy and your doctor gives you the green light, there's literally 0 downside to eating more spinach, eggs, and peppers. Your eyes benefit.
Your heart benefits. Your blood sugar stabilizes.
Here's what I want you to do this week. 1. Buy a bag of fresh spinach. 1 bag. Add a handful to 1 meal every day. Tomorrow, not next month. 2. Get eggs if you don't have them. 3 times this week, make eggs part of breakfast. 3. Pick 1 pepper, red or orange. Cut it up. Add it to dinner 3 times. That's it. You're starting the protocol. If you've been watching this far, you already suspect your vision matters. You already know that losing it would change your life. And you already know that waiting for your doctor to suggest this isn't a strategy. Because most doctors don't talk about prevention. They talk about management. But you're ahead. You know the answer. Now, you just have to act on it. Dr. Nakamura didn't get to 96 with perfect eyesight by accident. He ate these foods consistently for decades. And you can too. If this resonated with you, share it with someone you care about. Someone whose vision matters. Someone who's been squinting at menus and pretending everything's fine. Subscribe for more insights from longevity doctors who've actually protected their own sight. Your eyes can stay sharp, but only if you decide to protect them starting today.